my focus in this kind of work is oral history. And that's kind of how I came to it out of a background in theater and production of video, is through interviewing people and gathering stories. And so I'd learned in Edmonton through a number of projects about how that process could be made less wasteful. I mean, often when you're working in a documentary, for example, you'll do a massive amount of research, hours and hours of interviews, and then you come up with, an hour or 90-minute film, and a huge amount of that material is kind of lost. And whether it's in theater or in video, it had always seemed to me that there was so much there that you end up not using, because your choices on a given project are made by a certain set of parameters that the project, who it's intended for, who you're trying to focus your story on, that all kinds of other complex and really interesting detail and nuance disappears. So I'd learned in working with historian Catherine Cole and our community-based projects to revise the way of looking at that, to look at the research process as an end in itself, in which the material we collect, be it photographs or written materials or the oral history interviews, becomes part of a big collection that then becomes a public resource, goes to the archives, and it becomes something that people can draw on in different ways and interpret in different ways. So it's a matter of seeing the research and the historical process as separate from the interpretive process and the artistic process. So going into this again, I was really concerned that with 1919 we followed that kind of model, so that we were collecting a huge amount of material, disseminating it through ALHI and the website, and then turning my focus to a particular way into that material and a particular set of interpretive processes. So the question became oral history. Well, how do we get it? Because one of the reasons I put this project aside in the first place is I really felt like the characters that I was creating for the piece were not grounded in what reality might have been at that time, because I really was extrapolating in the dark. And so that's what I started looking for, is there any kind of actual words, any kind of verbatim materials here? And fortunately, in an early meeting where we started talking about this, Alvin said, well, yeah, there is this Mathers Commission report that went across the whole country collecting workers' stories at that time. And immediately I was like, okay, I need to read that material. I need to know what was said in Calgary and in Edmonton by the workers that came before that commission. And yes, I know it is a narrow spectrum, because it tended to be the established workers who were the, quote, elite of the working class at that point, the carpenters and the tradespeople. And there's relatively few women, but at least it's a point into the situation in people's own words. So we managed, through some connections that Alvin had in Ottawa, to get a researcher in Ottawa to go into because it was all stored in the National Archives, go in and methodically, page by page, scan all of the testimony that was given by workers in Calgary and Edmonton, and reproduce it and send it to us. So again, this became a historical resource for ALHI, but it also became the core of the work that we moved forward on, because you actually had the ability to read, and the interviews were way richer than I thought they were going to be. I mean, there was, particularly in Calgary, two women, Jean McWilliam and Mrs. Corse, who both came and made really powerful statements before the commission. The issue of privatized healthcare, because of course in 1919 was, well, what is Medicare? So we're like more than 50 years before any form of Medicare. So you had a highly privatized system, but frankly, I didn't actually know how that worked. How did that play out? So part of the research was just like finding out what happened if you got sick in a hospital. And the fact that there were these separate wards in the hospital. There were the public wards and the private wards. And doctors worked in order to be able to serve their patients in the private wards. They had to put in X number of hours in the public wards. But it's like, okay, that's very much the bottom of the priority list. And you saw how that played out in terms of them being absent from treatment, not engaged with treatment, handling too many people, etc. So that whole picture began to emerge around the hospital system. A second area was pay equity and the differentiation in the treatment of women in the workplace in 1919, which was obviously significant. It's the same as it was after the end of the Second World War, when my mother had to deal with the fact that people coming back from, the soldiers coming back, were given priority. Women in general, and particularly married women, were basically shoved out of all the positions they'd been holding. And that was still happening at the end of the Second World War. That was happening exactly at the First World War. And so, with a few exceptions, women working in munitions in the First World War were pushed out. So it became, a way into, again, looking at issues of equality in the workplace between men and women.